Well, communities around the world marked World AIDS Day this week. About 36.7 million people around the world live with HIV, including tens of thousands right here in Canada. In fact, according to the Public Health Agency of Canada, over 65,000 people in this country are living with HIV. About 2,500 are newly diagnosed each year, and about 13,000, or 20% of people living with HIV, are unaware they are HIV positive. And for those reasons alone, AIDS remains a public health threat, but one strategy many AIDS activists in Canada's Public Health Agency are now backing is called the U=U campaign. Now, we have to say it is controversial, and to explain more about it, we're now joined by Bruce Richman. He's been at the forefront of the U=U campaign, beginning in the U.S. and now internationally, and he joins us right now in studio. So, Bruce, thank you for this. So, as I say, it's controversial, but let's begin with the basics here. What is U=U and the campaign around it?
U=U refers to undetectable is untransmittable, and it describes the point when a person living with HIV is on treatment and the viral load, or the amount of virus in their blood, is suppressed to a level that it's so low that it's undetectable. And when it's undetectable, that person cannot transmit HIV to their sexual partners.
So they cannot transmit it, which I think goes against what many people think, because for so long, for so many decades now, the key message in safer sex campaigns has been about condoms. But if it's now undetectable and untransmittable, does that mean then that condoms don't have to be used?
No, the campaign and the message isn't about throwing out condoms. It's another option in HIV prevention toolbox, and it's actually the safest option in the prevention toolbox. Having an undetectable viral load is the safest way to prevent the transmission of HIV, but condoms are necessary to prevent for STIs or unwanted pregnancies, so it's really just another really exciting tool that we have in this toolbox to prevent it.
So why is it important to get the message out in terms of trying to stop the spread of HIV/AIDS? Why is it important to send out this message that undetectable equals untransmittable?
First and foremost, it's critically important because it improves the lives of people living with HIV. It means that we can have intimacy and relationships and have babies without fear of transmitting the virus to our partners. We've been living and dying with HIV stigma for 35 years, and now we have an unprecedented opportunity to dismantle that stigma. So first and foremost, that should be enough just to improve our lives and end HIV stigma that affects everything in the epidemic. But we're also seeing that this is a shift in people living with HIV getting finding out that they're HIV positive, so getting tested, going on treatment and staying on treatment in order to save our lives and improve our health, but also to stop the spread to our partners.
And the argument being that if you rid the stigma of HIV/AIDS, people will be more willing to get tested, people will be more willing to go under treatment, and therefore end the spread of HIV/AIDS?
Absolutely, absolutely. We're seeing people use the U=U message in testing campaigns, in adherence campaigns, in campaigns that are encouraging people to stay in care, and I think as importantly of any of this, in advocacy to make sure that everyone has the option to go on treatment, so that, for our own health and also to prevent the spread of HIV.
But we have to say the science is not new. It's been around for many years. And in fact, as we said, you're at the forefront of trying to get health agencies around the world. In fact, you were campaigning and succeeded to get the CDC, Centers for Disease Control of the United States, to back this message. But there is pushback because there's public health agencies around the world that are not comfortable with this message. Why is that?
There's so many reasons. Much of it comes from paternalism, and a lot of the root of paternalism is racism and classism and colonialism. But what we've heard, and even very early on in the campaign, was heads of clinics and medical associations would say, we know this. We agree with the science 100%. And on an individual level, in our clinics, we will share this information, but on a public health level, this could be dangerous because people living with HIV might not understand that, to many of us is very obvious, stay on your medication to stay undetectable.
Well, and we're talking about public health agencies, but Joe and Mary Public, there are those that will be listening to this going, they agree with that.
Right, and that's based in 35 years of fear of the HIV and of people living with HIV, and it's stigmatizing us. I think Joe and Mary Public need to know that people living with HIV at any level of viral load are not dangerous, and that if someone is undetectable, we cannot transmit HIV to Joe and Mary Public. We are absolutely safe, and folks who are undetectable have other options like condoms, and in some parts of the world, PrEP, a pill for HIV-negative people.
And if you get this message out and get rid of the stigma, then again, you're arguing that people will get tested. But you talk about how it's monumental in changing people's lives. How did it change your life?
Well, I learned in 2012, I might get weepy on national television. I learned in 2012 that I couldn't transmit HIV to my partner, and that changed everything for me. I hadn't been in a relationship in 13 years because I was afraid of transmitting this disease that caused so much shame and pain for me to someone I loved. So when I found this out, I was elated. But of course I was outraged because millions of people living with HIV still don't know they can't transmit HIV to their partners. Fortunately now, there are over 500 organizations from 68 countries in at least 15 languages that are sharing this message and ensuring that people living with HIV, our providers, our partners, policymakers, and the public understand that this is true and this is an important message to share.
And as of yesterday, Public Health here in Canada
Yes.
also backed the science for that. But again, undetectable equals untransmittable, reliant on having a zero viral load as well as being on a antiretroviral therapy, correct?
Exactly, and staying on treatment, staying in care to stay undetectable.
Bruce, thank you.
Thank you so much. Thanks for having me.